David?
What he said. So, thank you for that. You've just done a huge part of what I wanted to do here. So let's start with this. A lot of us who have been glad that there's finally been a recent gun conversation in the country have been very frustrated by the nature of that gun conversation. So it has been almost entirely about the spree shootings and measures to address that particular issue. A lot of people who feel like I do have been saying that that has been a mistake. I don't think it's a mistake, it is incomplete. So this is an estimate of the representation, the proportion of what the FBI considers mass shootings as a contribution to the overall national homicide toll. And this is actually an overestimate relative to the way the conversation has gone. The FBI definition is 4 or more victims in a single incident, which includes, unfortunately, an awful lot of pretty mundane gang and urban and domestic violence. It's still under 0.1% of the overall homicide toll. The rest of it is concentrated amongst what you have just heard about. It is urban, it is concentrated among men, it is concentrated among minority men, it is particularly concentrated among African American men, and everything we know right now says that yes, the national homicide rate has been going steadily down. This component of it is going up. Over the last 10 years, it appears that young African American male homicide victimization is increasing. It is happening in very particular neighborhoods. It is happening in neighborhoods that have a saturation of not only the issues John has just talked about, but also of mass incarceration. I work in neighborhoods where essentially all of the men have criminal records. So if you are in, I tell this story all the time and I just realized I'm in Washington. If you are a black male resident of Washington, D.C., this fine nation's capital, your lifetime risk of at least going to jail has now reached nearly 100%. If you are born black and male in this country today, you stand a 1 in 3 risk of going to prison. If you do not graduate from high school, the current estimates is that that goes up to 70%. And as you keep hearing about all these issues, this is not evenly geographically distributed. It is concentrated in very particular places. These are places that, in addition to all these other ills, and I was glad to hear the stop and frisk question, have a deeply historically and presently fractured relationship with law enforcement. Rod Brunson, who is a sociologist now at Rutgers, has a wonderful ethnography of young black men in these neighborhoods in St. Louis. The title of this article is it's a direct quote from one of his interviews, and it is called "The Police Don't Like Black People." And what we're now discovering about this is that there is a direct link between these perceptions of a lack of legitimacy on the part of the police and serious violence. If you are a young man in these neighborhoods and you know who has killed your brother, then you have a substitutable choice. You can call the police and cooperate with the prosecutors, or you can pick up a gun and get your friends and go take care of it yourself. And what I'm about to say is that an enormous part of the violence that we're seeing is this patterned reciprocal violence between people who have been witnesses to, involved in, over and over and over and over again. So in addition to all of that, these neighborhoods turn out to have some other particularly salient characteristics. And this is one representation. So this is produced by the Policing Institute at the University of Cincinnati, partners in work that we're doing in Cincinnati. This is a network sociogram of violent groups in Cincinnati. This represents every identifiable violent group in Cincinnati. These are gangs and drug crews and sets and little neighborhood posses. This has nothing to do with geography. This is laid out so that you can see the lines. Red is a standing vendetta, a beef, as we say. Green is an alliance, blue is volatile, and you'll see in the upper left-hand corner there are a bunch of groups that don't have these relationships. The normal pattern on the street is that groups beef, they ally, that can shift, but no matter where you go, if you are dealing in a neighborhood, a community with high levels of gun violence, you will find this underlying it. This is an empirical question, but so far it is literally without fail that you can go to these places, you can debrief frontline law enforcement folks and community people, and you will find this underlying what is going on. And you know David, and it will turn out as a matter of fact statistically that David is either running with a group like this or he is close to people who are running with a group like this. That's how it works. These group members are shockingly active criminal offenders. So even among folks who are at high-risk age in particularly active neighborhoods, these are the most active among the active. This is a criminal history breakdown of about half of the folks in that Cincinnati network. They average 35 prior charges apiece. And if you look at the third down in the right-hand column, about a third have 10 or more felony priors. These are the most active folks you will find in the most criminally active neighborhoods. And this is why this matters so much. There aren't very many of them. So every group member in Cincinnati collectively adds up to under 0.3% of the city's population, and they are involved as victims, offenders, or often both, with essentially 3/4 of all killing in the city. And again, this is the way it works. When you go to any city and do this analysis, you get this kind of breakdown. In Cincinnati, there were, in that sociogram, 61 groups, about 1,500 people. And that is the proportionality you get. In the most active neighborhoods, it's 5% of about the 18 to 26-year-old males. And of that 5%, it is about 1 in 5 who are truly active. So you are down in the most dangerous neighborhoods to 1% of young men in their high-risk years. And it turns out that there is something extremely immediate that can be done that makes a big difference. So this is the basic pattern of intervention that has now been applied since Boston all over the country. The one thing I will say about the Boston Miracle is that it wasn't. It was a lot of work, and it turns out that if you do this work, you can make a big difference. And when Boston stopped doing the work, it came back. They're now doing it again. It's going away again. The intervention is simple. The groups are identifiable. The guys in them are identifiable. Communities put partnerships together of law enforcement, social service providers, and community figures. That partnership enters into a face-to-face relationship with these groups, and it says to them, your community needs this to stop and needs you alive and out of prison. We would like to help you if you will let us, and the most important part of that help turns out to be this kind of trauma, new relationship work that you just heard about. And law enforcement says, we want to keep you alive too. We're telling you ahead of time the consequences that will follow if your group keeps killing people. That has been implemented in different ways. In many places, it consistently produces large effects. So the lower bound that we've seen over the time we've been doing this work has been about a 1/3 reduction in this kind of, call it gang homicide. It's not uncommon to have 50% reductions across entire cities. These are not program effects. They are in terms of cause and effect, but these are citywide effects or area of implementation effects. It's worked with groups. It's worked with individual violent offenders. We're seeing, as we get the data on this to be more clearly understood, how important these groups are. Anthony Braga at Rutgers is about to publish a study saying that in Boston, 40% of all domestic shootings turn out to come back to group members. This is simply a hyperactive population. Intervention with it makes a big difference.
As I said before, Garin, on the first day that one thought seriously about public health approaches to gun control, Garin was on the front line. And the most remarkable thing is that 20 years later, he's still on the front line. Garin?